Yeah, just a quick review of the book, Primary Care for the Physical Therapist, Examination and Triage. Basically, the book's divided up into three sections. I'll go over each one briefly just to let you know what's in the book. The first one is called Foundations. Here it talks about evidence-based measures for diagnosis and outcomes. Also talks about like patient interview, skillful communication, that kind of stuff. Second one is examination and evaluation. Talk about like symptom investigation, chief complaint by body region or chief complaints by symptoms. Also identification of health risk factors. Cardiovascular and pulmonary systems reviews also here. Upper and lower quarter screening examination. And also talks about labs, imaging, other things too, like EMGs and nerve conduction velocity tests. Third one is life cycle and special populations. Here they talk about things like, the obstetric population, which is growing, no pun intended. Adolescent population. So yeah, I mean, as you can see, this book covers a lot of information. I think it will definitely help anyone stay up to date on the best practices that involve things like examination, medical screening, patient management, communication. So yeah, very good book. Another good book I know of, written by a physical therapist, and you also, if you're doing a lot of primary care, also come across people with rotator cuff problems. This is another one, also written by a physical therapist, also very evidence-based. It's good information for you, or basically, this is a book you can hand patients. Everything's in layman's terms. Basically goes over like what the rotator cuff is. A lot of pictures if you're a real visual learner. Then it goes into, like what the rotator cuff does, that kind of thing. Part two, really the best part of the book, answers you need to know. Here it talks about all kinds of things you ever wonder about rotator cuffs. What are symptoms of a rotator cuff tear? Are there any arm maneuvers that might indicate you have a rotator cuff tear? What imaging tests are usually used to diagnose a rotator cuff tear? Where does it tear at? Lots of other really useful, are there different kinds of rotator cuff tears? All evidence-based answers. Each one of these boxes is like a study, and it also, backing up the information, the answers to these questions. I have a rotator cuff tear, I'm in a lot of pain, I need surgery, right? Well, not necessarily, because according to this, there's a big discrepancy between like the size of your rotator cuff tear and how much pain you're in. So you can have people with a huge tear that really don't have much pain, according to these studies, or you can have people with a small tear that really, is giving you a lot of pain. So, and then you can there's not really, sometimes a lot of correlation between tear size and the amount of pain you're in. What will happen if I just leave my rotator cuff tear alone? Well, the only way you're going to know that is if you go through all the research like this book does, and you take people that have a torn rotator cuff and you follow them for like 5, 10, 15 years, and you see what happens to them. Does it get better? Does it repair itself? Does it get worse? This book has done that, gone through all that. So how does exercise compare to surgery when it comes to treat my rotator cuff? Well, evidence-based medicine, the only way you're going to know, look at the randomized controlled trials. And basically this book has gone through every single one of the randomized controlled trials that's published out there, comparing surgery to just an exercise program. Come to find out, make a long story short, exercise gets you to the same place as if you've had surgery. That's what the studies say. To that end, the book ends with an exercise program. Basically, it's 3 different levels. There's a beginning, intermediate, advanced. Some of your patients have acute tears, and they can hardly move their arm. They have some real basic exercises for that. Other people yet have kind of a chronic tear. Never really did much about it. They can still do a fair amount of exercise. Yet you maybe start with the advanced or intermediate program. It's a very good book. If you want to learn more about rotator cuff problems and management, and answers to a lot of questions patients ask you in primary care, this is a good book. And this is a great resource for the primary care physical therapist. So check it out.